I'm going to walk you through how to do the hovering position from hands and knees position. So what I would like for you to do is you're going to get in hands and knees position, hands directly underneath the shoulder, and making sure that your hip is stacked directly above the knee, and your feet are going to be flexed with toes into the ground to connect your feet into the ground too. So you're going to find that neutral spine position. You want to make sure that we're not overly arched and dumped down, where now I have a large arch in my back, and I don't want to be too rounded either. A really good way to try to find your neutral position is you can kind of go into a cat-cow back and forth, and then find middle. And of course, in therapy, we're going to help you find that if you're having difficulty. The goal is that in this position, you can always check to see if you're in good alignment too, is if you take like a nice breath in through your nose. Do you feel the rib cage expanding on your side? And do you also feel that you're breathing into your back too? So once you're in that neutral position, you're going to zip your core up. You're going to engage, especially into the lower abdominals. You're going to maintain that tone in your shoulders too. And we're going to activate our hamstring to make sure that we're also able to hold our pelvis in a neutral position. And so when you engage the hamstring, what you're going to do is you're going to feel that you're pulling your sit bone down towards the ground a little bit. But remember, we don't want to over-engage where we're actually pulling the sit bones too far down and now we're rounding. Just enough to help us maintain that neutral position. So once we are set, everything is engaged from the core, from the shoulder, and the hamstring to help hold your pelvis in. What you're going to do is, as you maintain your core, you're going to exhale a little. You're going to lift the knees up. You're going to try to maintain that position. So we're still in neutral. I have the tension in my shoulder, in my core, and my hamstrings are engaged to help my pelvis stay in place. You're going to breathe through it. You do not have to hover too high. The closer you can get the knee hovering to the ground, the more challenging it's going to be. But what you don't want is you don't want to hover up into the air. So it's only about maybe half an inch of the knee lifting off of the ground when you hover. You're going to maintain that position for however long your therapist wants you to maintain. You're going to do the number of sets, however many your therapist wants. And that's going to be our hands and knees hover position.